afternoon, everyone. My name is Richard. I'm your moderator for today's telephone town hall hosted by your MPP Lisa MacLeod. We're also joined on the line today by Dr. Vera Etches, Chief Medical Officer of Ottawa Public Health, Dr. Andrew Faulkner, President and CEO of Queensway Carleton Hospital, and Anthony DeMent, General Manager of Emergency and Protective Services, City of Ottawa. And they've all taken time out of their extremely busy schedules, as you can imagine today, to join us and help inform you all of what's going on. And so we're going to start by hearing from all those folks, first from your MPP and then those from the medical system. And we're also then going to go into your live questions on our telephone town hall, so that if you do know at this point that you're going to want to ask a question live on our telephone town hall, please press *3 on your telephone keypad and you'll get in the queue to ask a question. Again, that's the star button and 3 on your telephone keypad, and you'll get in the queue to ask a question. Again, for those of you just joining us, this telephone town hall is hosted by your MPP for Nepean, Lisa MacLeod, and we're joined by Dr. Vera Etches, Chief Medical Officer of Ottawa Public Health, Dr. Andrew Faulkner, President and CEO of Queensway Carleton Hospital, and Anthony DeMent, General Manager of Emergency and Protective Services from the City of Ottawa, who've taken time out of their extremely busy schedules to join us and help inform us all today. So with that, I'm going to turn things over to Lisa MacLeod to make some opening remarks. And then again, your reminder, if you do know that you're going to want to ask a question, or if at any time you want to join the queue to ask a question, please press *3 on your telephone keypad, and we'll get you in the queue to ask a question at some point. We are going to ask everyone, again, there's going to be a lot of interest, I'm sure, as there was on the last one of these that we held just recently. So again, we're going to ask you to keep your questions as brief as possible so we can get to as many as possible in the time that we have. So with that, I'm going to turn things over to your MPP for Nepean, Lisa MacLeod.
Thank you very much, Richard, and thank you all for joining me on this very special telephone town hall regarding COVID-19, its public health impact, and the fallout for our community and the economy. This is open to all Nepean residents. I'm grateful that Ottawa's Chief Medical Officer of Health, Dr. Vera Etches, is once again joining me along with Dr. Andrew Faulkner, President and CEO of the Queensway Carleton Hospital, and our new addition, Anthony DeMent, the General Manager of the City of Ottawa's Emergency and Protective Services Department, who oversees bylaw enforcement and our paramedic service. As you know, this is the second town hall I've hosted in the last 4 weeks. The first was in response to our first set of emergency measures enacted by your Ontario government, and after the spring economic and fiscal update. Living through these uncertain times, your Ontario government continues to follow the best advice of our public medical officers of health and continually monitors our measures and essential business lists as they relate to the public state of emergency. The Ontario Legislature just today extended the public state of emergency for an additional 28 days. I know this is difficult for many, as all levels of government aim to contain the spread of COVID-19. But like all decisions made to date, they are both tough and necessary. That is why today we enacted additional measures. School will not be reopened on May the 4th. Hospital-based teams will move into our long-term care facilities. We've placed a 6-month moratorium on OSAP loans, and we will be allowing municipalities to extend their bylaws. Additional changes to support boards of education and municipalities to respond to COVID-19 were also put in place today. As Premier Ford has said, the end of this story will be written by all of us, which is why it is important to maintain social distancing and to ensure self-isolation where required. Our goal is to save lives and to lessen the burden on our healthcare system during this pandemic, first and foremost, which is why your Ontario government has cleared a backlog of 11,000 tests, created the self-assessment tool and lab test updates at ontario.ca/COVID-19, and has placed an order of 900,000 COVID-19 testing kits from Nepean-based Spartan Bioscience. As Dr. Faulkner pointed out 2 weeks ago, we now have an assessment facility on Moody Drive. And in Ontario, we will be testing up to 18,900 people per day by mid-April. I also recognize the fear of contracting COVID-19 and the fallout in the economy can be very stressful for residents and can cause anxiety and other mental health pressures. For mental health supports, please contact ontario.ca/mental health or go to Ottawa Public Health. for support related to you, your family, or your business, please call my office at 613-823-2116 or email lisa@lisamacleod.com. We might be working from home, but we are here to work for you. I also know many of you have questions and are eager to hear from our medical and emergency and protective professionals. So I will now turn it over to Dr. Etches, then to Dr. Faulkner, and finally to Mr. Monte before we open the lines to your questions. Thank you.
And just a quick moment before we go to Dr. Vera Etches, you did just hear from Lisa MacLeod, your MPP for Nepean. I do want to let all those just joining the line know we're going to be hearing from Dr. Vera Etches, Dr. Andrew Faulkner, and Anthony DeMent as we go forward. But also that if you do want to get in the queue to ask a question, please press *3 on your telephone keypad. Again, that's the star button and 3 on your telephone keypad to get in the queue to ask a question. With that, I'll go over to Dr. Vera Etches, Chief Medical Officer of Ottawa Public Health, for some remarks.
Thank you. Thank you for this opportunity to share information and answer your questions. As of 4 p.m. yesterday, Ottawa Public Health is investigating 619 laboratory cases of COVID-19 in the community, and there are 15 ongoing outbreaks in institutions. 2 institutional outbreaks have been resolved, and that is 33 new confirmed cases from yesterday. But we also have 217 resolved cases. There are currently 42 people in hospital, and 16 of them are in the intensive care unit. And this is a capacity that is manageable for the healthcare system. Right now, the healthcare system is busy working hard to think about how they can have more capacity if needed, but they are managing. And I want to take a moment to encourage everyone who is experiencing any emergency-like symptoms of shortness of breath or chest pain to go and use the emergency. They are open. There are lots of capacity there for you, and they are practicing good infection prevention and control measures. Unfortunately, 12 people in Ottawa have died related to COVID-19, and 11 of those were over age 65. Last week at City Council, I spoke to polling information, a survey done by ECOS, on what Ottawa residents think about COVID-19 and how they're changing their behavior. And I'm really happy to say, and I want to thank all of you on the line, that 84% of people have changed their behavior in response to COVID-19 to stay away within 2 meters, more than 2 meters away from others to protect from the transmission occurring. And so that is really making a difference. We see that. The cases in Ottawa would be much higher if people were not taking these measures. And I want to thank you. Unfortunately, as we'll probably discuss today, there are downsides to this physical distancing that we're doing, and the restrictions are limited. One thing we know is that there are some homes, and so one of the resources that out today has been created by Crime Prevention, the Ottawa Coalition to End Violence Against Women, Interval House of Ottawa, and the East Ottawa Region Protect and chat that allows women experiencing violence and abuse to get help and support. It may not be safe phone call. So this resource and others are advertised on our Facebook and Twitter and webpage, and I do encourage people to continue going to ottawapublichealth.ca for the latest information.
Okay, and thank you, Dr. Etches. For those just joining, and I know there are a few that are still coming on, this is your telephone town hall here is hosted by your MPP for Nepean, Lisa MacLeod. We've just been hearing from Dr. Vera Etches, Chief Medical Officer of Ottawa Public Health. We're going to go next to Dr. Andrew Faulkner, President and CEO of Queensway Carleton Hospital, but did want to let everybody know after that, and Anthony DeMonte, General Manager, Emergency and Protective Services, City of Ottawa, we're going to go to your live questions. Please press *3 to get in the queue to ask a question. Queue is already filling up. We're going to take a look at what the questions are and try and make sure we have somebody who's got a chance to ask every different type of question and get to as many as we can. Do keep them brief as we carry on here. So again, *3 to get in the queue to ask a question. We'll go next to Dr. Andrew Faulkner. Please go ahead.
Thank you, Minister MacLeod, for inviting me to participate in this town hall. I think these town halls have been a great opportunity to share with the wider public all of the efforts that are going on to tackle COVID-19. There's still a long way to go, but the decisions being made by everyone every day bring us closer to getting through this. I want to express my most sincere thanks and gratitude for the tremendous outpouring of support Queensway Carleton staff have received from the public over the past few weeks. People and businesses have done so much to support our staff, everything from donating food and masks to sending cards and putting up signs. These gestures, big and small, have meant a great deal to all of us here at Queensway Carleton. I also have to acknowledge our staff and physicians for their incredible response to the COVID-19 outbreak. At the hospital, we've responded quick to the factor of both our size and our culture. The team has been agile in adapting workflows and care models to meet our new reality. I'll give you a couple of examples. I'll start with our ACE unit, which is usually specialized to provide acute care for the elderly. Normally, staff on this unit focus on helping elderly patients recover and head home. However, given the modern design and the layout of the unit, we've decided it was the best space for us to manage COVID patients. Our staff quickly changed their workflow and model of care and are doing a fantastic job looking after those patients who have COVID-19. We've dedicated the ICU to COVID-19 patients. The ICU has been very busy. We've confirmed 6 cases here today. I'm proud of the team and the care that they're providing. We've opened a second ICU for non-COVID patients in a temporary space in our surgical area. We've opened the COVID-19 care clinic at the D. Aubrey Moody Intermediate School in Bells Corners. This new clinic is a partnership with Ottawa Public Health and the Region's Clinical Care Coordination Center. It's operated by Queensway Carleton Hospital staff along with several community physicians, and it provides an important health service to Ottawa residents. We're generally seeing between 60 and 80 patients per day. In taking on treatment for patients experiencing symptoms of respiratory illness, which cannot be managed at home, the clinic has absorbed increased patient volumes, which would have otherwise ended up in our emergency department. This allows our emergency departments to remain clear to deal with other emergencies. And to echo what Dr. Etches said, we are using appropriate protective equipment, and we are all open for other emergencies. In the clinic's first week of operation, we saw a steady flow of patients that was well within the clinic's capacity. Yesterday, the clinic saw over 60 patients, and our staff administered swabs, x-rays, and other tests. One patient was transferred to our emergency department. The clinic is open every day from 9 a.m. to 4 p.m. Our emergency department is seeing lower numbers than normal, but the patients are sicker. And the community should know that if they need urgent medical care, our emergency department is there for you. All of our teams from each department have stepped up in this unprecedented situation. Regionally and locally, we've undertaken a lot of work to prepare and respond to COVID-19. However, we continue to do other planning to adjust to the situation as it changes and unfolds. I think we all know that the coming weeks will continue to be a challenge for everyone. The single most important step that can be taken right now is to stay at home as much as possible. Continuing to keep our physical distance from one another, though difficult, is the best way to get through this outbreak and support the healthcare workers. We have an incredible team at Queensway Carleton Hospital, and I'm so proud to work with them every day. I firmly believe that by supporting one another and making smart choices every day, we will overcome this challenge. Thank you.
Okay, great. And again, it's a telephone town hall hosted by your MPP for Nepean, Lisa MacLeod. We're going to go next to opening remarks from Anthony DeMonte, General Manager, Emergency and Protective Services from the City of Ottawa. And next, we're going to go into your live questions. Please press *3 if you want to get in the queue to ask a question. Anthony, please go ahead.
Good afternoon. I'd also like to extend my thanks to Minister MacLeod for inviting me to participate in today's Teletown Hall. This situation is evolving very rapidly, and keeping residents informed has been a top priority for the City of Ottawa. This town hall is an opportunity to answer your questions and address your biggest concerns. We may not have all the answers, but we're committed to being open and transparent and I assure you that we are doing everything we can to keep Ottawa safe. The city and the province have been in lockstep taking significant actions to help flatten the curve. I want to also reassure you that all city services will continue to provide essential services during this unprecedented time, as providing safe drinking water, waste collection, public transit, and responding to emergencies, and many other services the public relies on. We are focused on continuing to provide a support to the most vulnerable in our community, and a human task force group has been established within our City Emergency Operations Center to work closely with community partners to respond to urgent community needs, including food distribution, long-term care, emergency child care, social service, homelessness, and shelter needs as well. The city has established also a gathering and events task force, as well as community economic confidence task force within our Emergency Operations Center. These groups are in place to support small businesses and event organizers who are all hurting deeply as a result of COVID-19 pandemic. Our Mayor, Jim Watson, is also co-chairing an economic partners task force with members of our business community to maintain open lines of communication, as well as assess and implement measures to support locally owned shops and restaurants. As a city, we need to do everything possible to protect the health of our healthcare workers, first responders, and many others providing essential services on the front line. The Ontario government has issued emergency orders to keep the public safe and reduce the spread of COVID-19. And exceptionally, our city bylaw officers have taken a progressive enforcement approach, first focusing on education for several weeks, then issuing verbal warnings. But now we are proceeding with fines as provided for by the province under Ontario's Emergency Management and Civil Protection Act. The vast majority, I would say overwhelmingly, the public has responded and is doing what they need to do. And so we are doing so to protect the public and need people to understand that their actions can endanger others. We will continue to make decisions and take our actions based on the orders set out by the province, but more importantly as well, the professional advice from our province's Chief Medical Officer of Health, as well as Ottawa's Public Health Unit led by Dr. Etches and her dedicated team. We are all in this together, and I want to thank you for being caring citizens and neighbors and for doing your part for the greater good of our entire community. I look forward to answering any questions you may have and concerns as part of our discussions today. Thank you very much. Merci.
Okay, great. And we're going to start right into our live question and answer session. Again, please press *3 if you want to get in the queue to ask a question. Please, when I call on you, please just go ahead. Please do keep your question brief and to the point. We're going to go first to Laura, who's been on the line for quite a while now and has got a question about COVID-19 and infants. Laura, are you there?
Yes, I'm here. Thank you very much.
Please go ahead.
I hear a lot in the news about obviously vulnerable populations and seniors, but they don't speak much about the susceptibility for young infants. I have a 3.5-month-old daughter, and I'm a single parent actually, so it's quite just us at the moment. And I'm wondering if anyone could offer a little bit more about the risks to her, and if it's something they're seeing a lot in infants or not.
It's Vera Etches. I'll jump in if anyone else wants to add. So that's a challenge, being a new mother without the usual access to support. So I do hope that you can also reach out virtually to people when you have questions. Ottawa Public Health has a Parenting in Ottawa website with more information about breastfeeding or infant feeding, other, lots of information, and you can chat with a nurse that way as well. So on this question of whether infants can be infected, they can be. That's why it's important to keep your distance from others. Keep 2 meters away if you're out for a walk. And the challenge is that very young infants under a year of age do seem to have more complications than other children. So, children of any age can get infected, and it seems that most children over a year of age are able to handle that infection very well. So we're seeing very few children even having a confirmed test because they're not sick enough to present to a hospital emergency room or be tested. We do know the virus infects children, but it's just not severe enough to be showing up in high numbers. And the challenge with the infants is that they are just their respiratory rate is already higher. An infection, a respiratory infection, just is that much more difficult for them to cope with. It is also why we're recommending that pregnant women in the last trimester, the last 3 months of their pregnancy, if they develop signs of a respiratory symptom like a cough or a fever, that they should be tested as well. So if pregnant women in their last trimester are one of the groups where they can go to the assessment center and be tested for COVID-19 so that we can make sure that we take the right precautions to protect their infants.
Okay. And again, it's *3 to get in the queue to ask a question. We're going to go next to Jan, who's got a question about accessing other medical care and blood tests while this issue is going on. Jan, you're live on the call.
Hi there. Thank you very much. My question is, under normal circumstances, I would have access to all my normal healthcare services and any diagnostic testing, blood testing, etc. I was just wondering, the labs happen to be open. Is it safe to go to the lab for blood tests for non-COVID related issues?
Here, I guess I'll jump in again. Since this COVID pandemic, has been discussed as a risk in our community, all kinds of healthcare settings, including labs that take blood, have been putting in more measures to protect the people that use their services. And so those measures would include screening. Usually, if you have a fever or a cough, if it's still necessary to get the blood work, people would ask you to wear a mask. They're going to ask you to keep your distance from others. The staff will be protecting themselves. So this is something, if it's an important condition to continue to have blood work done, then that's what the labs are open for, to make sure that people can get the health care they need, even in this time.
Thank you. And we're going to go next to Taryn, who's got a question about the ways that public health are going to determine when it's safe to lift restrictions. Taryn, you're live on the line.
Thank you for taking my question. Yes, I'm interested in knowing what the indicators are that the public health officials will be looking for in order to determine when it's safe to lift the social distancing, physical distancing restrictions.
I'm going to take that and then I'll pass it over to Vera. Just today, the Premier and our government made a decision at Cabinet to extend the order for another 28 days. So we are taking the lead from our medical officers of health across the province. We obviously want to make sure that when we start to reopen, whether that is our community events or the economy, that it will be safe to do so. And so, again, based on the medical advice that we have received at the province, we have decided to, again, enact an additional 28 days, which is why the legislature sat today, to enact that, as well as to make sure that kids were not back in the classroom as of May 4th and a few other orders. So I'll hand it over to you, Dr. Etches, but just in terms of when we expect the province to reopen, it will be based on their advice.
Absolutely. Thank you, Minister. We're going to be working together on this because it's not up to one area to say this is the time now to start to relax restrictions. We're going to be very much coordinated. I can give you an idea, though, and I want you to know that this is our goal. We want to be able to relax the restrictions as soon as it's safe. We know that there's a lot of hardship, and so we are already talking about these kinds of things. How would we do that safely? So the top things that we want to have in place are enough hospital capacity to be able to handle a rise in infections again, because we anticipate as we let up on the restrictions that there could be a large population that's not immune yet, and then more people could become in contact with each other and become infected. So the hospitals are doing their part. They are making sure they have surge capacity and extra beds and extra ventilators that they can call on. So we need to make sure they have everything they need. Do they have enough masks? Do they have enough gowns? Do they have enough staffing So all of those pieces related to having a good, strong healthcare system need to be there. The other thing we want to see is that there are signs that the infection is actually decreasing in our community. And looking at the case numbers, the confirmed laboratory cases is one way. It's not perfect because we're limited in our testing, but we can look at hospitalizations as a very strong indicator. If someone is that sick, they will end up in hospital. And so once we start to see the hospitalizations drop, that's a good sign for us. The other thing we do want to have in place before we relax restrictions somewhat is to know that we can test people who might have COVID-19 in the community. So even more and more, they're increasing the ability to do tests, and then that would help us be more confident and secure so that we can find individual people who are infected and follow up with them and their contacts and try to contain the disease that way. I can tell you, we're not going to just say go back to your normal activities all at once. I think that's fair to say that we're going to be looking at what are the priorities to get going again? How do we do them maybe in different ways? Maybe we need to continue physical distancing even as we go back to some activities. So these things are all being discussed.
Okay, thank you. And again, star 3 if you want to get in the queue to ask a question. We're going to go next to Kim, who's got a question about those living with mental illnesses. Kim, you're live on the line.
Hi, thank you for taking my call. My concern is with my sister who lives alone. She's about a 15-minute drive from me, and she suffers from mental illness, more specifically some paranoid schizophrenia. And her family has always looked out for her, and I'm the only one in the city with her. But I'm really, really concerned. Before the physical distancing came into place, you know, I would visit with her and take her to get grocery shopping and stuff like this. Last, I just dropped some groceries off at her door, but she's not answering her phone. She's not returning my calls, or any of the family. My brother in New Brunswick has a keen interest with looking after her as well, and not returning his calls either. What can I do? I mean, we're told to stay in our own home and not to visit family members. I don't know what to do for her, and she's not well enough to call those mental health reach out lines and help centers.
Yeah, that's really challenging, and I'm glad that you're there for her, that you care about her. I would recommend in this case, that you think about how you may be able to safely do reach out to her. It depends on your own medical conditions and your own safety, but if you want to reach out, sometimes we do have to have interaction with others for their own good and take that risk of the infection because something else is more serious or potentially life-threatening. So, I think this is a case. You could also call a crisis line, and that team, if you think there's something really wrong, that team can be prepared also to go in and address something. I don't know, Dr. Falconer, if you had anything you wanted to add about. Certainly mental health crisis services are still in operation.
Yeah, they are. And this particular population is vulnerable in that they may stop taking their medications and relapse. So I really like the advice you gave, Dr. Etches. In addition, we're changing our model of care for those with mental health to provide more virtual care. So in the normal circumstance, our psychiatrists are now seeing people over Skype or Teams or other virtual platforms to check in every day and make sure they're okay. In this particular case, that might not be overly helpful, so I think some sort of a visit either from a crisis team or other provider may be helpful.
Okay, we're going to go next to a question from Maria, who's concerned about the delay in reporting cases. Maria, you're live on the line.
Hello.
Hi, Maria. Go ahead with your question.
So I'm monitoring numbers of cases in Ottawa, it's first of all, it's very hard to find out this information, and also it's not clear how often it's updated and how if somebody did the test yesterday, when it will appear on the chart, and how we know a number of cases.
Okay, so the number of laboratory confirmed cases in Ottawa comes from the lab tests that people are having taken, whether they're in hospital or in an assessment center, in a care clinic, and it takes some time to get the laboratory test processed, but that number of days is really dropping. So there was a backlog. At some point people were waiting longer than a week to get their test results, but that has been cleared up. And so now the lab test is usually available within a couple of days at the longest. People can access their own test result through a provincial portal. So the province of Ontario has made the lab test results available online so people can check themselves. So this also speeds things up. If you're talking about the number of cases in Ottawa, and you want to know what's happening in Ottawa, the Ottawa Public Health.ca website, if you search for coronavirus, it has a section that's about what is the situation in Ottawa. And the situation in Ottawa then includes a daily report. So every day we put information up about the number of cases in Ottawa. And that information is based on the day before. So if there's any laboratory case that's been confirmed by 4 o'clock the day before, then the next day's report will show that information. And that's what we continue to do on a daily basis.
Okay, we're going to go next to Charlie, who's got a question about cottages. Charlie, you're live on the line.
Yeah, thank you for answering my question. As a result of the storm yesterday, I was wondering, does the province have specific restrictions for residents such as in Ottawa to go out to their cottage countries to visit their property just to check for damages?
Thanks, Charlie. I appreciate that question, and I have to say the other hat that I wear around the cabinet table as Minister of Tourism, this comes up quite a bit. I would encourage, and I'll get Dr. Etches maybe to chime in after this, but this came up as well at an Ottawa Board of Trade event today that I did with the Mayor as well as the Associate Minister of Finance federally. We're urging every Ontarian to stay at home and not make unnecessary travel. That includes going to smaller communities where they do not have the necessary healthcare resources. I have heard this time and again throughout the province, where small communities without the healthcare capabilities are accepting visitors from the larger cities, which has compounded a lot of anxiety and concern in the community with regard to the spread of COVID-19. In addition, with respect to the border between us and Quebec. We, as Ontarians, have decided not to police that border. However, the Quebec government has decided. We, again, say all non-essential travel should be reserved until after this crisis is over. So I would strongly urge anyone on this line who may have a cottage in Westport or Gananoque or any other community just to really consider traveling only once restrictions on social distancing and self-isolation have been lifted. But perhaps our medical professionals may want to add to that.
I agree with you, Minister. The idea is the less we can encounter others, the better. And so we are asking people to stay home unless they need to go out for groceries or out to get prescriptions filled, health care, or to check on someone who needs help. If you're supporting an older adult or somebody else who needs help. And then daily physical activity is also important to keep us well. But you're right, if travel isn't part of those activities, it's best to be avoided.
Okay, and we're going to go to our next question here, which is directed to Anthony DeMonte from Jim, who's got a question about bylaw officers. Jim, are you there?
Yes, I am. I just a little bit embarrassed at some of the reports in the newspaper of what I would consider very overzealous bylaw enforcement. Where there's no crowd, there was a father and a son, and they end up with a several $100 fine. I believe there was 2 reports of that nature. Is there anything that can be done to educate the bylaw enforcement officers in the terms of discretion?
Well, thank you, Jim. I appreciate you giving me the opportunity to talk about this. You're correct. There was a few reports in the media. Actually, one of those reports, the individual didn't get a citation anyway. But let's put this in perspective. I think what's important, and I think you're suggesting that as well too. So the officers do have discretion. Not just bylaw officers, but police officers as well have the authority under the Act to put late charges if required. But as I said in my opening statement, the overwhelming majority of people in Ottawa are respecting this. And the reason we're doing all of this, all of us as a community, is to ensure that we're saving lives and following public health. Now, the Government of Ontario has deemed appropriate that we have these tools in exceptional cases. And I can give you an example. We've been doing a lot of proactive intervention with people. Just since April 2nd, when we started looking at starting to do enforcement and laying charges if it was required, bylaw responded rather to over 2,077 calls. And of that, only 75 charges, so less than 3%, or in the 3% range rather, needed to get a charge laid. And there are examples of, as a matter of fact, on Thursday, we went through complaints about a barbershop operating with people sitting in a waiting room, and so there was no social distancing, etc. We initially intervened, and we were told, no, everything's fine, there's nothing going on here. On the Friday, we got another call and another complaint, and we did a bit of investigation, and there was actually a business operating, which is contrary to what our government decided is an essential service. And they made these decisions not lightly, and I think they're important. So in that case, charges were laid. In the cases you're talking about, too, as I mentioned, one, there was no charge laid, even though it was reported that way. And the other, well, there was a bit of a discussion, and there wasn't compliance per se. So I just want to indicate, again, the less than 3%, the vast majority of people on our water are respecting and listening to what our public health officials are telling us. Yes, we have these tools, and you're absolutely right. Yes, it's key important for us that our bylaw officers use discretion, and I can assure you we are doing that. Thank you.
And Tony, it's Lisa. I have to say, when we take the decisions around the cabinet table as a legislative assembly on what's essential and what's non-essential, on social distancing and other emergency orders, we don't take them lightly. We carefully consider them. We meet daily as a cabinet, and I know I'm the local MPP, and this is the primary reason that I'm on this call, but I want to back up our bylaw enforcement officers as well as our police. We have been told by our public health officials that we must stay out of our parks, stay off the trails, only open a business if it is deemed essential. And so I think at this point in time, we owe a debt of gratitude to all of those who continue to show up on the front lines, whether that's on our healthcare system, whether that's law enforcement, whether that is our grocery store clerks, our pharmacists, or our truck drivers. When they're continuing to keep the supply chain going, they're continuing to make sure that we live in a peaceful, law-abiding society, and at the end of the day, they're also making sure that they're saving lives. And so I just can't reiterate enough how important it is to follow the guidelines put out by the public officers of health and follow the rules put forward not only by our provincial government but also by our municipal and federal governments as well. So, Anthony, thank you so much for that.
Thank you, Minister.
Okay, and with that, we're going to, again, our MPP was hosted today, and of course our medical officers and doctors who joined the line have got other responsibilities to attend to, and certainly thank them for their generosity with their time today. So with that, I'm going to turn things over to your MPP for Nepean Lisa MacLeod for some closing remarks.
Thanks very much, Richard. I would like to say a very special thank you to Dr. Etches, Dr. Faulconer, and Mr. Monte. I think I speak for all Nepean residents in expressing our pride and admiration to all of you and your respective teams who are on the front lines of this crisis, trying to keep us healthy and safe. I believe you're heroes, each one of you. I want to reiterate the numbers you can call and the websites you can access to all Nepean residents. For people and business supports, please call my office at 613-823-2116 or email lisa@lisamacleod.com. My staff are waiting and willing to work with you. To take the self-assessment or to receive lab results, visit ontario.ca/COVID-19. For mental health support, you can go to Ottawa Public Health, speak to the Queensway Carleton, or access ontario.ca/mental health. For bylaw support, call 311. And for Ottawa Public Health, you can call 613-580-6744. I want to again take this opportunity to thank all Nepean residents for taking their time today to talk with myself, Dr. Etches, Dr. Faulkner, and Mr. Monte. I wish you all good health. I hope you all stay safe, and I look forward to getting to see you all again in person when it is safe to do so. Until we meet again, thank you.